I'm Danielle, CNE at West Coast General Hospital for Peds and Perinatal. Today we'll be reviewing in our video how to initiate ventilation therapy using the Hamilton CPAP ventilator. Ventilator setup. Note, the Hamilton nasal CPAP ventilator will always be set up for nasal CPAP mode. The following steps are to switch it from nasal CPAP mode to function in ventilator mode. Step 1. Disconnect ventilator tubing from CPAP generator and remove pressure gauge tubing from side of ventilator. Attach the circuit Y to the end of the expiratory white and inspiratory blue tubes. These can be found in the neonatal ventilator circuit pack. Step 3. Attach flow sensor to circuit Y. This can be found in its own packaging with a clear calibration adapter included in the package. Step 4. Attach pressure lines to ports on the side of the ventilator. Clear line attaches to the white port and the blue line attaches to the blue port. Step 5. Attach calibration adapter, used for the pre-op check only, to the end of the flow sensor circuit. Step 6. Spike sterile water for inhalation bag with spike from humidifier chamber, if not already done. Step 7. When ready for use, turn on Fisher-Paykel heated humidifier. Default settings are set to invasive at 37 degrees. This is what it should be set to for both nasal CPAP and ventilator mode for the neonate. Step 8. Turn on ventilator. Select intubated PCV mode. Step 9. Input newborn's weight. This is mandatory in ventilator mode. Default settings will be to 15 centimeters of water for PIP control and 5 centimeters of water for PEEP control. Oxygen defaults to room air at 21%. To adjust respiratory rate, inspiratory time, hit the control tabs and adjust per direction from the pediatrician. Prior to starting any ventilation, the patient must be disconnected from the ventilator during pre-op check. Pre-op check for ventilator. Touch pre-op check button on the screen. Perform the tightness test. Follow the prompts and occlude end of system when it says tighten patient system. Wait for the green check. Once you get the green check, proceed to flow sensor check. Flow sensor check. For this step, the vent will prompt you to turn flow sensor. You will need the calibration adapter still attached for this step. Hit flow sensor button. When prompted, turn flow sensor around as indicated and attach the calibration end to the Y piece. When prompted to turn the flow sensor again, remove the calibration adapter and turn the flow sensor back to its starting position. Note, the O2 cell test is not mandatory and can be done on a PRN basis, and the vent will prompt you when to perform it. To begin ventilation therapy, attach flow sensor end to baby's ET tube and hit start ventilation. Discontinue use of the Hamilton CPAP ventilator. Remove from patient and turn off the Hamilton ventilator. Hold power button down for 3 seconds. Hit power button on the Fisher-Paykel heated humidification system to turn off. The light blue neonatal expiratory valve and attached membrane are to go to MDRD for cleaning, as well as the blue temperature probe wire. Note: we have one pink temporary disposable expiratory valve as backup, located in the nursery. Please remind MDRD that the expiratory valve and membrane must be returned ASAP for next setup. The outside of the Hamilton ventilator can all be wiped down with Virox wipes as well, as needed in between patient use.